Can you see the screen? Hello?
Yes, sir.
Right. Okay. Very good morning, everyone. We will be discussing about a journal club, and I will, for the next 20 to 25 minutes. This will be a brief class to start with because many of you will be really very scared about that. Okay, so this is a very boring class about journals and things that we are not very, very happy to read. So I will take you, believe me, I will not bore you out. But I will tell you how exactly you, as a surgery resident in a second year, third year, maybe first year, should think about reading a journal. And I will go definitely with you regarding line by line about the journal. So rather than make a PowerPoint presentation, I will exactly show you that in a real world, how do you and me read a journal. Now, the topic that I have taken up is around 4 to 5 years old. So you may say that, okay, so that's okay for us. And the topic that you can see on the screen is technically from a very reputed journal called as the British Journal of Surgery. In fact, it is the most reputed journal in the European countries and is one of the best journals in surgery that we all read, particularly in the Indian subcontinent. Now, so whenever we talk about the journal, definitely the journal metrics do matter a lot. And what do you mean by metrics means that I already brought the Wikipedia page for you to make you understand is that there is a word that you are asked in your DNB exams. Now, please remember that whatever I am going to say regarding this journal club, there are many tidbits that are going to come out, and they are all asked as a part of your OSCEs or in your MCQ examinations of the future. Now, there is a term called impact factor. Now, the term impact factor technically means that how many times this article that you can see today will be quoted from or in the future text. So, for example, this was published in the year 2018. Okay. So, thereafter, from this time, from this journal called as the British Journal of Surgery, or in a year, say for example, 23 is going to end soon. In the year 23, how many articles across the world or journals did quote British Journal of Surgery? So in this case, as you can see, the impact factor for this is 6.93. So that's a pretty big impact factor for a journal. And if you consider other journals, remember that the Annals of Surgery, more or less, has an impact factor of around 8. So if you talk about the specialties, journals on molecular biologies, etc., they contain much more impact factor. But if you consider a clinical discipline, around a 7 impact factor is very good impact factor. So this is how you read or know what is an impact factor journal. Impact factor means the number of the times the journal is quoted in 1 year, usually an academic year like 21, 22, 23, etc. So this is called as an impact factor. The topic that we are going to read or today is a very interesting article. I don't know how many of you are fans of chewing gum or you may have had chewing gum when you were young. What is interesting is that chewing gum after an abdominal surgery means all the things that you do very commonly, is what is the effect of a post-operative outcome on patients who are having chewing gum. So that's an interesting topic. Now, so what is important is that when you search about the topic, this is an open access article. That means that you can go to the internet while we are reading now. You can download it free of cost. There is no restriction on the download. Hence, I took up this topic. Now, talk about something called the metrics of this one. So when you talk about the metrics, now what does the word means? If you see these words called altmetrics, now what does this word altmetrics means? Altmetrics means that these are those alternative metrics, like the time this metrics is tweeted or what are the readers on other platforms, like say for example Mendeley is a platform. So that means altmetrics will mean rather than have the usual platforms of metrics, this is an tweets or shares. Say for example, how many times this was tweeted on Twitter, etc. So this is an alternative metric. So what is the traditional way that we as clinicians or doctors will read a journal? Please remember you are given a DNB question called as an author H index. We have already learned about impact factor. We have already learned about citation counts. Now, when you talk about citations, what is the citation? See this one. Citation means the number of the times this article has been quoted. Now, the graph that you can see tells you this one. So there are total citations, field citation ratio, relative citation ratio. Now these are newer things that you should know. What is field citation ratio? What is relative citation ratio? So these are all those areas that you never read. So this is one new thing that you have learned today is technically journal say times the things are quoted or what is the field citation ratio means in this field. Say for example, colorectal surgery, abdominal surgery, this article comes. What is the relative citation ratio? It means that the article, if it is more than one, like this one, the relative citation ratio is 2.41. It means that this is performing much more better than other articles in this field. So please remember that this is called as a relative citation ratio. There are many people who will never be hearing about this. So the reason I took up these things are that these are things that you will not be knowing. So this is something called field citation ratio, relative citation ratio. H index means that you as an author, say for example, this gentleman, the first author, maybe that we need to know how many times his articles are getting repeatedly cited across other journals. This, remember, is a very important mark that we all like to attain. And this is an MCQ question as well as your DNB question. Now, let us come back to the journal article. So we took around 5 minutes to learn about this. Let us take around the next 15 minutes of the journal. Now, as I've already showed you the article that this is a multi-center randomized trial on the effect of chewing gum after abdominal surgery. So that means, what are the things that we already know? Now, ladies and gentlemen, we already know what is a post-operative ileus. We are surgeons. We know that after an abdominal surgery, there is a delay in the function of the bowel. That means the passage of the flatus or the feces is delayed by hours, maybe a day. That is technically called as a post-operative ileus. That means intestinal peristaltic sounds are usually delayed in their time. What is ERAS? Now we know ERAS. ERAS has come in a big role, meaning enhanced recovery after surgery, which technically means that there are interventions that are done in the preoperative period that make the patient go home early, make the patient have quicker recovery. How to decrease the post-operative ileus? We all know that your teachers have been telling you that do not routinely use a nasogastric tube. Start quickly oral feed. And finally, you have heard about a randomized control trial in your NEET PG preparation days. Remember that there are two groups. One is a treatment group, one is a control group, and then both of the groups are followed up, and you know what is this one. The second important point, what is very essential, is that you need to randomize them. This is usually done by a computer. And the next important part is you need to do something called as a blinding. As the researcher who is interpreting the result should know that what group, okay, was essential, but that is only after the results are out. Last one, there should be an ethical reason for the trial. So these are things that you knew about. Now again, come back to the journal, the first page. Let us quickly read that journal. And before you start reading the journal, understand that there are few things in the journal that needs an interest. Now, remember that these lines of a journal will usually mean the author list of the journal. Next is these are the departments of surgery from an hospital in Netherlands. Okay, so they have read about. This part of the journal is something called as an abstract. So if you are reading a journal for the first time in your life, this, remember, is called as an abstract. Now usually the journals will tell us to write abstract in words. So please see that the abstracts are written very easily into various topics. And if you are in very short of time, remember this is written as a background. methods, results, and conclusion. Like in this one, their basic background was that the postoperative ileus is a complication of abdominal surgery that leads to discomfort, morbidity, and prolonged hospital stay. Okay. The next is that they did a method in which there were 12 hospitals. They did a randomized controlled trial of standard post-operative care compared with patients in the post-operative care who are given chewing gum. So you say, Acha, this is an interesting. And then after that, they said that addition of chewing gum to the ERAS post-operative pathway does not reduce the length of hospital stay. So they have said that. So with this, remember the article also has a very interesting word called as DOI. Now DOI technically means a word called as digital object identifier. Now please remember that these are things that the national board examinations will sometimes ask you as a part of your basic research. What is DOI? This means a unique number for this article or a fingerprint of the article. Now, the first paragraph of any journal article is something called as an introduction, like as you can read in the introduction. What is there in the introduction is that I have read about the introduction is that they have said that one of the ERAS methods, early postoperative feeding, is considered effective in stimulating and thereby reducing postoperative ileus. Okay, so they have said that when you feed patients early, it helps. Next one they have said also is that, but there is the incidence of nausea, vomiting in 27% of the patients. Now, then they came up with a concept about something called as sham feeding, which technically means that it stimulates the bowel movement. And what they have said is that sham feeding means, so what is normal feeding? You allow the patient to take some food. Sham feeding means that you make the patient stimulate something in which the patient feels that he is eating food which he does not. So that is called as a sham feeding. So when you talk about that, so the best thing that comes to your mind is always the chewing gum. And there are studies, so they have shown in their references 19 to 25 that it is shown to stimulate the motility of the entire GI tract with saliva, gastrin, and pancreatic juices. So for this reason, there are various research groups which have suggested that instead of feeding the patients early, you give chewing gum. So it will have the same effect of the ERAS, but if your boss does not want the patient to feed early, no issues. As a replacement, but you want an ERAS protocol. So then use a chewing gum. So that's an interesting thought about this. They have also proposed that there are some things in chewing gum like hexidols which have a beneficial effect on restoration of bowel movement. So, and the basic background is that there are several trials. So they have quoted multiple trials which have shown that there is an say better thing when you give a chewing gum in the post-operative period. There are even Cochrane reviews. Now, Cochrane means technically is a big free library. So you are requested to visit this free collection, and they will be important in something called evidence-based medicine. So what does this Cochrane thing say? The Cochrane thing said that chewing gum reduced the time to first flatus, reduced the time to first bowel movement. So what does it mean technically? It means that the Cochrane people will collect all the data across the world and they will say that is this good, is this bad. So if you understand this statement, it means that chewing gum is good. So that means it is good for promoting the bowel motility. So if you did not know this before today, so this is something that they did from Cochrane. But now these people, this Amsterdam group, what they did was they were not very happy with this. So they said that, sir, this Cochrane people, that your trial that you did in your Cochrane data per patient trial was only 20 to 50. So you have collected all small data and now you are saying that the results are effective. Well, that is one way of saying, but what we are going to do is that we are going to collect a large database. So as you know, the more number, the better is the result. So for this reason, these authors concluded that it is better that we will, rather than calculate multiple data, we will have one large RCT, which will be the final word. And as you can remember, In an evidence-based pyramid, what sits on the top is technically a systematic analysis and meta-analysis. And then immediately after that, on the second step, it's a randomized control trial. So this is technically a very high evidence of data in which they had only one research question. So if you now see these lines, which I will underline with the red, the research question is that does chewing gum to the ERAS protocol after an abdominal surgery have any better effect in outcome, or is it just your chance that this group had a better outcome? So that means, simple word, this thing is called as the research question. So whenever you are given a journal article to be read, remember that you always try to search the research question, like the way you see I have found out the research question. Okay. Now they have said that, okay, boss, we have done everything. So they said to the readers like you and me, is that this was designed to detect clinically relevant difference in length of hospital stay. Now, the time you write your thesis, remember, your boss tells you that write something called as a primary objective. So this one will be a primary objective. Okay. And this one called as in addition to bowel recovery. So this will be the secondary objective. So I hope I have made you understand up till this point. Okay, so this is called as a secondary objective and a primary objective in understanding how to find out in a journal article what did these people say about this. Okay, now there is a word called high external validity, which technically means that internal validity is something that do in your unit, maybe your hospital. So they took a design in which they compared many hospitals across, and what they said was that whenever you are writing again your thesis, remember you write something called inclusion and exclusion factor. So the inclusion factor was that patient should have an abdominal surgery. So that's pretty easy. If you're thinking about doing a thesis on this one, you can do that. Okay. Now, their hypothesis in the whole story was that the chewing gum could lead to a reduction in length of hospital stay 1 day or more. That means if you have done a laparotomy or a lap chole, say for example, your hospital stay is on an average 4 days. So these people propose that, okay, maybe it will be at least 2 days or 3 days. That means they need a benefit of this. Now, their null hypothesis in this article is thus that chewing gum does not lead to any benefit. That means that is the null hypothesis, or you can take the null hypothesis is that the chewing gum is beneficial. So in this case, the null hypothesis was that the chewing gum was not beneficial in making this one. So they will either prove the null hypothesis or they will disprove the null hypothesis. Okay. So with this one, I think we have understood up to the first point. Let us see now how did they do the study. So the first title was something called introduction. The next thing is something called as a methods in the study. Now, how did they do the study? Now, they did the study as a multi-center randomized control trial. How many multi-centers? That means they took 12 hospitals in Netherlands. Okay. Out of them, 11 were a teaching hospital like your hospital, and one of them was an academic center. That means they contain big academicians. Maybe they did not have a direct undergrad postgraduate program, but they were doing some academic programs. Now, what is important is that trial should be registered. Now, in an Indian perspective, remember that we have something called CTRI, Clinical Trial Registry of India, where it is ideal that before you start the trial, you should have a permission from this authority. So again, these are done. So they said that, okay, so this is the protocol that we followed, and this includes the standard ERAS protocol, something that you read about this. Okay. And then they said that now when we talk about the randomization, so that means you need two groups. I told you, na? One is the study group and another is the control group. But all the patients were undergoing abdominal surgery. All of them were undergoing everything and they were having an abdominal surgery. Now, what kind of surgery is not essential, but this is this. So, how did they randomize? They randomized by using a web-based computer-generated randomization, and before the surgery using minimization method. So, these are all statistical things that we'll read little bit, but remember that the basic thing is that you need a computer-based randomization. Now, what kind of abdominal surgery? Remember that they did usually these things in elective surgery. They did not do in emergency. And on the types of these ones, so what they did was they divided all abdominal surgeries into two types. One was intestinal by a laparotomy, intestinal by a laparoscopy, or they did non-intestinal. Say, for example, an abdominal aortic aneurysm, which is non-intestinal. So there were technically groups that they made. Intestinal or GI or non-GI will be a better division. Now, after that, what they did was they were now shown with 30 minutes of chewing gum, and now so they had mentioned about that this one is the control group, the standard post-operative care, and this one is something called as the intervention group. So you are asked in your exams, how is it, what is the intervention, what is the intervention in this group? 30 minutes of gum chewing, 30 minutes of gum chewing. So what is this chewing gum? Chewing gum is chewing gum, man. So this is 30 minutes is the intervention that we did. Now, what is important is that the groups were done by one people, but the results were seen by another group. Okay. And then they made something called as a study pro forma. And then as the way you do your thesis, this is the same way that they did. And remember that this is the blinding that they did in this study. So by this time, I hope I have made you understand that about what are the ways that these people have done this. Whenever you talk about participants, this means you are talking about the inclusion criteria and the exclusion criteria. Now, what do you mean by inclusion and exclusion criteria? Remember that something in yellow will be inclusion. So they were aged 18 years or more, elective laparotomy or laparoscopic resection are into this. Something in blue is exclusion, so we'll mark it like this. The exclusion criteria was emergency surgery, inability to provide informed consent, risk of choking on the chewing gum, and dysphagia due to pre-existing neurological disease. So please see, this is exactly the way you do your thesis. Okay. Now, so they also said that we did an ethical clearance, the thing that you did. So if you're thinking that, wow, this is a very easy one, this is the reason I took up this study from the British Journal of Surgery to make you understand that you can also publish, provided you can please take up this way of the template of doing this study. So please understand this is the way a randomized trial is done. Okay. Now they also gave a declaration that we don't have any particular sponsoring of any brand, like brand A or brand B. So they said that there was no sponsoring in this, that okay, so this brand of chewing gum is good. Okay. Now the intervention that was done, that means the study group. So what is the thing that was done in the study group? The study group was done that they were told, so how many times they were allowed to chew the chewing gum? Chew the chewing gum 3 times a day for half an hour, starting from the day of surgery. So that means POD 0. You tell the patient in the evening, okay, start chewing gum till he will be discharged from the hospital. So that is the intervention. Patients in the control group, remember, they will not be having any chewing gum and they will have the standard post-operative care. Maybe start an oral feed on the day one, etc. So this is not recorded by researchers, and what is important is that what chewing gum, etc. they were there. Even they had gone to such a beautiful extent of telling about that. Okay, these are the things that were there in the chewing gum. That's it. Now, what is the outcome? This is something that I'm interested on. As I have said, what is the primary outcome? Okay, the primary outcome is okay. If you're listening to this, guys, what is this primary outcome? What is this LOS? Hello. What is this LOS? If you are not muted, what is this LOS? This is the length of hospital stay. Am I audible or am I visible?
So audible, sir. Audible
Good.
and visible.
Right. So what is this LOS? LOS is the length of the hospital stay. So what is the primary objective that you started the study? Remember, we started with this one. What is the primary objective? It was length of hospital stay. Okay, so what is the outcome that they are trying to measure? Is the length of hospital stay. What is the secondary outcome before you go to the next page? Can any one of you tell me the secondary outcome in this one or the secondary objective in this one? What is the secondary objective? Anyone, please? Hello? Anyone? What is the secondary objective? Okay, I did not get an answer. That's sad. Remember that the secondary objective is you are required to see the time to pass the flatus and the time to do a defecation. So what is important is that understand that their primary objective was length of hospital stay. The secondary objective was the time that it takes for the bowel to move. That means time to pass a flatus and time to defecate. Now, so these secondary objectives are calculated in hours and minutes at the end of the surgery and was reported by the patient. So this is everything that you do every day. When you go for the rounds, you ask the patient, did you pass flatus? Did you pass stool? So they did the exact same thing and they calculated this. And they also calculated about some complications. How do you calculate complications? By calculating a score called as Clavien-Dindo. Okay. So beyond this, they have taken all of these diaries that are on the data, and they have said that like when you publish that this is the study pro forma that we have given, will not be talking about. Sample size calculations, they have said that was based on the primary endpoint or the post-operative length of hospital stay. Okay. Now, what they have done before you go for the rest of the thing is that the study design in this one is complete. Now, the sample size calculation will not be going to the depths, time is short. What we'll now see is that how did they have the results? Now, this is something again that you are asked in your exams about what is this thing that you get to see on the screen now. Now, this, ladies and gentlemen, is something called as the way that a randomized trial is represented. Okay. So, what is this thing usually done? That thing is given in your exams as something called as a consort statement. So, please remember the name. Particularly in your MCQ exams in future, this is a very, very favorite thing to be asked. Which part is favorite? So you'll be given an MCQ which is asking you which one of the following guidelines is used for a randomized control trial. Can you tell me which guideline is used for a randomized control trial? Okay, I do not have any answers to it. That's very sad. Okay, the answer is which one is used for a randomized control trial? Which guideline is used for a randomized control trial? Come on, guys. Which one is used? Hello. Which one is used? Is a consort statement for a randomized control trial. So when you are doing a thesis, if it is not a randomized observational, you can use these ones. Just remember the name. So what they have done is that the consort people will give you this kind of a flow diagram. And in this flow diagram, remember that now again come back to now you can see that okay, so this is how a consort people have made. What are the parts of a consort? Understand the parts. First is in any randomized trial, what is the first thing that is done? You enroll your patient. So the first thing is you enroll. This is the number one thing that you do. What is the second thing that you do? You allocate your groups. Now see the groups. What are the two groups? This is the control group, and this is the intervention group. So please remember, this is a control group, this is an intervention group. And even they have said control group was 1,000 people, intervention group was 1,000 people. Okay, what is the total number? 2,000 people. Now what they did was, after the chewing gum story is done, they, before the chewing gum story, they excluded 34, excluded 25 because of money reasons. They said that. After this one, at this point, remember that the intervention was done, okay? And after they found the intervention, what they found was that they did an analysis out because of the outcomes. Now, more or less, they said that the primary outcome, that means the length of hospital stay, and this length of hospital stay was there. Now, if you compare the length of hospital stay, control group, what was the control group? The control group was the standard ERAS. What is the intervention group? The ERAS group, where you have added something called as a chewing gum. What is the length of hospital stay in people who had the standard ERAS? This is 966. What was the thing in which chewing gum people had the length of hospital stay? Was 975. That means they stayed in the hospital more than the standard group. That means the intervention group did not do that well. So now let us see what happened with the time to pass a flatus and stool. Again, but these were more or less equal, guys. More or less equal. So now what they did was, so if you now want to have a very focused review about what really happened, so but let us make two big boxes then. On this side, you have the control group. What is the control group? Can anyone tell me what is the control group? Hello. What is the control group? I do not have any answers today. That's very interesting. Okay. The control group was the ERAS group only. What is the intervention group? The intervention group, remember, are the group in which the patients were given a chewing gum. Okay. And in this group, now if you can see both of the groups, if you can match both of the groups, it will be easy for you to look into and see that. Now see, both these groups, they were comparable. That means it is not that these data are coming from two separate groups. If you compare the baseline characteristics of these groups, both of the groups, control and these, they were technically comparable. That means you can compare the data. It is not that one group had more patients, one group had less patients, one group had more elderly, one group had less elderly. No, both the groups were equally comparable, and hence this is to prevent a bias called as a selection bias. So whenever you talk about biases, remember that you need to control the groups so that you avoid a selection bias. So this is how we do that. Now, so we have talked about consort. Let us now see what are the procedures which are done. Are you comparing this? The answer is yes. Again, on both the groups, both of the groups were comparable. So finally, we come to the last part. So, sir, what was the result? Simple bar diagram about the primary length of the primary outcome is the length of hospital stay. Now, if you can see from this group, okay, more or the less, the red bars, which means that the patients were having chewing gum in this group, if you can see, the red bars were staying in the hospital little more than the violet bars. So that simply means, in a simple way, is chewing gum better than the control? What is the simple answer? Is chewing gum or intervention better than the control group? What is the answer, guys? Is it better than the control group? Even they have told you the p-value, that this is by chance or not, is 0.7. What does it mean by this is the next of the few words. But in a simplistic word, that simply means that your intervention group and the control group, intervention group is not more effective. So the intervention group is not better than the control, or the control group is better than intervention group. I hope I am clear with this. So now after they have said, there are few things that they have said about the statistics part of the story. This is something that I will take a minute to make you understand, because I get a lot of things about, sir, we did not understand anything in statistics. We understood nothing. Okay. So what I will like to do is that I will like to make you understand each line, because every line is an MCQ and an exam question for the national board. Now they said that all the analysis in this one so was done with a line called as intention to treat analysis. Now this is a very important question for your national board exams. In a randomized trial, what do you mean by the term intention to treat analysis? And then they said that all eligible patients were included in analysis and they received the assigned treatment. Now, if you see this part, what is an intention to treat analysis? Intention to treat analysis means that in a randomized trial, remember there were two groups, intervention and a control group. Now, what happens is that there is an event thing that is called as a crossover. Crossover means the patient who was not having chewing gum decides that no, I'll not be having a chewing gum. On the other way around, the other group says that okay, chewing gums are tasty, they will go into this group. So this is called as a crossover. Now, due to a crossover, you are saying that oh my god, my randomized trial is done, man. So I cannot take. So what is done is that there are two ways to do this. One, something called as per protocol analysis, which means that all the crossover people, you said that like this chap and this chap, okay, and this chap and this chap. So these people who are doing crossovers, you remove them. The others who are not doing crossover, the pure people, you take them. That one is called as a per protocol analysis. Please remember the names. They are given as questions. What is the other end? Other end is that yes, you take both of them. You take the intention, regardless of what they had, you take both of them with the original idea that they were in that group. So what is important is which one is better. Okay. Now, the intention to treat analysis is the better one, but you are required to know that this study used an intention to treat analysis. So this is the first thing to remember. The next thing to remember is that they measured these data and used some statistical test called as a Mann-Whitney U, as it was not normally distributed. Now remember that you will be asked by your exams or in your Viva, what do you mean by these statements? Okay. The number one is that it is not normally distributed. Now, what do you mean by this normal distribution and these things? Okay. Now, these data means technically that a normal distribution curve, as you know, is a bell-shaped curve. But this group probably had a skewing of one side. It can be a right, it can be a left. Okay. So, if you see their own data, if you see this one, as you can see, this is not a normal distribution type. Okay. So if this is not a normal distribution, then what are the tests that you use? Remember that for a normal distribution, the tests that are used are called as parametric tests. Whereas for a normal and non-normal distributed data, you use non-parametric test. Now, what is important is that if you want to take a screenshot, please do. These are things that are mandatorily asked in your exams. So, as a part of a journal club, it is essential that you know all of these tests. That means what is a test of a significance, what is a significant p-value, what is a non-significant p-value. These are things that you must understand. The next thing that you should understand is what do you mean by these types of data, like what is a nominal data, ordinal data, interval data ratio. If you are screaming that, okay, I read this in community medicine, yes, you read that in statistics, but remember in a national board exam or in an MS or a postgraduate super specialty exams, you are asked about these questions. Okay. Now, what are the tests of significance that you do? If you want to take a screenshot, kindly do, because these are the things that are now very, very hot in your MCQ circuit. And if you're appearing for a DNB exam, again, people are going to ask you, what test did you do for what? Remember, you are a clinician who must be doing these for your thesis. What is the test that is done? Now, remember that in this group, these people were two independent groups. So if you remember at the first one, chewing gum, non-chewing gum. Their length of hospital stay was in terms of a categorical data, that means numbers. Is it parametric? No. So you will not do a student 2 test. It is not done. But you will do a non-parametric, that means not normally distributed. Hence, you did a Mann-Whitney U or a Wilcoxon rank sum. This is all that you need to know. Please remember that this is all that you need to know. And this table is something that I use always when I read a journal article to understand why they did this test. You are asked this question: what is the test that will be done? This is the test that is done. Now, always remember that there are 4 types of data: nominal, ordinal, interval, and ratio. Please remember this table, and believe me, all of your problems will always be over. So always remember that this is the test that we do in statistics. So I've spoken long enough for these months. Okay, if you want to take a screenshot about these statistics things under one cover, please take a screenshot, because these are essential for one page summary before you appear for your exams. So these are the tests that you don't get under one roof. You read this in your NEET PG days. This again comes back when you're reading a journal article and your MCQ exams for super specialty. Now, finally, we see after this, what is the outcome that we attain? The outcomes that we attain, and we end the class with this, is the length of the hospital stay, the median. Now, what is the median? Is it numerical data. In the control group, that means no chewing gum, was 7 days. The patient stayed in a hospital. In the chewing gum group, it was 7 days. So, is this outcome significant? The answer is no, it is not significant. Remember, what is that significance thing? The p-value should be less than 0.05. So, this is a very, very big p-value. Now, talk about the next one. The surgical approach, again, laparoscopy, laparotomy, did it make a difference between the length of the hospital stay? Remember that up till this group is the primary outcome. That means the length of hospital stay. This group is the secondary outcome. That means, did the patients on a chewing gum pass flatus early? The median time was 23. They had 24. So this is the control group. This is the intervention group. Did the chewing gum people pass flatus early? The answer is no. It is not statistically significant. So please remember that part of the story. Okay. The rest of the things, if you compare them, complications was not significant in any of these. It is not that people who had a chewing gum had more complications. So with this, we now understood about the primary outcome, we learned about the secondary outcome, and we learned about complications. Finally, they said in any article about the discussion that what are the things that they found different, what is an ERAS, and what are the points that they found out. So in that ultimate conclusion, so before we go to the final datas and before we end, the final words were, based on this multicentric randomized controlled trial, if you give chewing gum to patients having ERAS protocol following an abdominal surgery, this did not have any decrease in the length of hospital stay, time to first flatus, and time of first defecation. The important point is that means if you give your patients chewing gum in postoperative period, the thing that Cochrane review told you to give, there is no benefit extra that happens. So this is a very landmark article in that, particularly in those people like me who are now in favor of following ERAS protocols. So this completes your journal reading. I hope you have learned today about how is a randomized trial done, what are the components of a randomized trial, what are the research hypothesis, what is the consort guideline. You learned about a few statistical tests that are done. So with this, I will conclude the class. Please ask me or feel free to ask me any questions. Hello? Hello. Hello.
Yes, sir.
Right. Any queries or any questions?
No, everything, sir. No, it's raising any questions.
Okay then. Thank you everyone. Thank you.
Thank you.
Ramanuj, good
Ah,
morning.
good
ডক্টর
morning.
বসাক
Sir, good morning.
আমাদের সময় তো এসব ছিল না রামানুজ, এত জানতাম না। তোর খুব ইনফরমেটিভ ক্লাস হলো, এবারে আবার খুলে পড়তে হবে, কিন্তু এটা তো প্রত্যেক এমএস স্টুডেন্টকে জানতে হবে না এখন যা অবস্থা।
Yes, sir.
ভেরি গুড, থ্যাংক ইউ। তুই যে
Sir,
এত লুসিডলি বললি, খুব ভালো লাগলো।
but sir, you have to know this, মানে particularly
না,
for
এটা জানতে হবে না, এখন জানতে
you
হবে।
have
মাস্টারমশাইদেরও জানতে হবে, যারা থিসিস করাচ্ছে এবং যারা করছে তাদেরও জানতে হবে।
Yes.
দারুণ দারুণ বললি, খুব সুন্দর।
Thank you. Okay.
Thank
Okay
you.
then. Thank you everyone.
বাই বাই।
Thank you, sir.